think that Future Focus Finance can link in with what you're already doing in the West Midlands in terms of FSD and HFMA?
I've got to say I'm really excited. I'm always excited, but I'm really excited that it's not just HFMA and FSD, it's actually all the other organisations that have come on board, like Monitor and the Department of Health, that are actually getting involved, because I think that gives it more clout. HFMA are absolutely fantastic. I've been a member of HFMA since I was 18. And according to today, I'm the longest serving member of the NHS, and I started when I was 6, honestly. So I've always been passionate about HFMA, and that's why I got involved as the FSD lead and on the board. And the board, I mean, I'm just a lead, and I take, you know, what I do is I just take from everybody what it is that they want. And if people don't communicate that to me, I can't actually pass that on. So I try to be representative for the health sector, in particular the sector I'm in, which is mental health. And I try and make sure that FSD and HFMA take into account everybody that's involved in the finance function. Because when I was a very young person, if I said I worked in finance, it was automatically, oh, you pay my wages. I think there's a broader view now that there are sort of business support as well as management accountants and financial accountants and so forth. But I do feel still that more could be done to engage people at the lower levels, to get them as excited about learning as maybe, you know, people like myself. So, for example, the more transactional people, they, like payroll, as I mentioned them already, they are critical. If you don't get paid right, if a clinician doesn't get paid right, there's always hell to pay. But I sometimes feel that this level of stuff is ignored and not listened to, and they're not always as engaged. And this is sort of my sort of personal journey to try and get that sort of thing sorted. So I'm hoping that this programme will actually touch everyone, as that's mentioned already, not just the ones who are qualified or qualifying and going up the ranks. I want this to mean something for everybody. That's my...
I'm not sure I can go around and touch 1,000 people, never mind 15,000 people. But so what do you think that we can do locally, working in the West Midlands and maybe making that work across the country in terms of engaging, using your existing systems to engage with those people, maybe at the more technical level of the organisation?
Well, maybe what needs to happen is maybe like, if I talk about payroll again, maybe payroll managers should get together and see if they can come up with something together and spread the word, you know, across the region, rather than just keep it isolated and share best practice in that sort of field. And the same with accredited clerks, and the same with debtor clerks and so forth. That, you know, it's not just about qualified accountants. And if everybody can be as enthusiastic about what they do, because you spend a lot of time at work, you know, I think we've achieved something now. Okay, so it's about networking in the different parts of finance, I think.
So broadening that more widely, what do you think that you do in the West Midlands at the moment which would be useful for us to pick up on and use on a national basis?
Well, as we've got this board. I don't know if it's replicated across the country, and I feel that, you know, things are starting to move on, and there are more courses, masterclass courses for sort of people on a lower level. And it is about the soft skills as well as the technical skills. I mean, that's being rolled out this year, and I'm hoping that that will then sort of expand to more finance staff accessing that.
Okay, so, and how do you think that the local board will try and build Future Focus Finance into what you're doing for your colleagues across the West Midlands?
You'll have to ask Becky and Co that. But I mean, I'm hoping that other FSD leads will actually take this on board and push it forward, and see if we can come up with any ideas or initiatives so we can actually spread the word. Okay. Webinars. I mean, we do share webinars in our organisation, so hopefully everybody else will try and do the same.
Okay, that's great. Thank you. Thanks very much, Giovanna. So, Raju, at lunch you came to find us, and you were very keen to say how important to you being involved in this is personally. Can you perhaps explain to colleagues why you think it's so important that we're doing this, and how you and your fellow clinicians can help us and we can help you?
Thank you for inviting me. The reason I went and spoke to David and Ross was looking at future-focused finance. I wasn't sure how far into the future we were looking at. There is a opportunity to try and get to clinicians when they're very early in their career, maybe even when they're medical students and they're looking at doing electives. You probably know about medical students go off and do electives in various things. Some of them go off to Africa, to other developing countries, and if they're interested in a particular field or specialty, they try and go and do 6 weeks or 8 weeks in that specialty, just to show their interest in that specialty. And people, medical students who are 3rd or 4th year are probably only fairly recent as far as maths and numbers are concerned. So if you try and kindle their interest at that time, then maybe that will keep that interest going through their careers, and by the time they come to being consultants and being in contact with finance people, at least they'll have a much better understanding of what they're talking about. At the moment, I don't think any of the clinicians have an understanding of NHS finances except what they see in the media. By the time they actually get involved, they're well into their careers. So what I was speaking to David was about trying to have a module where they could do an elective in NHS finances, just to have a better understanding at medical school, to see how the finances are actually given out to different hospitals, where the money comes from, which different areas it goes into. So they have a better understanding on being more selective with how they make use of these finances for patient care. So they have a bit more responsibility, a bit more ownership of trying to, when they come up with new initiatives, just make sure that the financial side of things are also taken care of. So from that's what I was suggesting, that maybe something like Warwick has got a new initiative. About a month ago, they started this collaboration with Warwick Business School and Warwick Medical School. They're both sort of very much in the same Warwick University campus. They've got this new lecture series going on. And so get involved with somebody like that and start this module, which is aimed at medical students initially, and then expand that further to try have a bit more finance input into their careers when they're junior doctors, when they're a bit more senior. So they have this understanding and they take it through to them. And I know the benefits of this won't be seen in the next 5 years or 10 years, it may be further down. But if you're looking at future of finance, I think that's something that we can do. And we'll get the benefits later on. The other thing that I was talking about is trying to break down the barriers that are evident everywhere between clinicians. And I can see that they both speak different languages, and both groups are frustrated at different times that the other group can't really see their viewpoint. I think it has to be a bit more open approach from both sides to understand that, you know, there is a reason why this group is saying is something. I mean, there is a reason why finance is saying such and such a thing isn't financially viable. There is a reason for it. Perhaps try to change the language so that it's understandable to both sides. I was just saying in my group just now that, for example, if a clinician comes to you and said, look, we need to do this business case for starting this particular treatment or this particular care, which is different to what we're doing now, they usually come and tell you about what is different, what is being offered. Perhaps a little bit more explanation as to how it would benefit the overall NHS economy. If we do this thing, this is what the patient gets out of it. Perhaps this is how quicker they would get back to work, and this is how they would contribute to the economy. Maybe a little bit further details. And also, I was just saying that rather than clinicians coming to you and only for this time to get business cases done, perhaps it would be nice if they come back to you a few months down the line when this has actually been implemented, come back and say, you know, the thing that we did 6 months ago, these are the benefits. This is how many patients that have been benefited. And these are the boxes of chocolates that I received from them. Why don't you have a little bit? It would actually provide a bit more focus and context to you as finance professionals to see that the effort that you put in is actually benefited, and there is actually individuals that have benefited from it directly. And especially now, I mean, Twitter and things have been promoted now by the NHS to try and contact with patients. Whether we believe it's the right thing, whether it's going too fast or not, I mean, it's happening already, and it's inevitable that it will go forward. Perhaps in future, if you're on it, perhaps you will be included in the tweets that are being sent by patients thanking people, and you can actually see the benefits directly. And I think that would probably provide more inspiration to take these things forward.
Okay, thank you. What's really intriguing for me and heartening actually is that what Raju's been talking about there is almost exactly the conversation that we had with our clinical colleagues on our pre-engagement day. I think there is a real desire amongst clinical colleagues to work much more closely with finance. If we go and knock on the door to say, can we talk with you, I'm pretty sure that door will be open very rapidly and we'll be invited in. So for me, one of the key things about this, people ask me what is different about this particular piece of work compared to what we've done in the past. I think one of the things is that we're really looking to try and take finance much more widely out into the organisation. Not focusing on what we're doing and making that the best it can be is really important, but actually broadening our horizons, talking to our clinical colleagues. And we don't just mean doctors, we mean nurses, we mean AHPs, we mean everybody across the whole of the NHS. They're willing to talk to us. If we go and talk to them, we can really make our finance function something to be really proud of, something that's connected into what we are all here for, I hope, which is to help patients get the best treatment they can, and to help our clinical colleagues deliver the best services they can. So I guess that's why we're all working in the health service and not in PricewaterhouseCoopers or Grant Thornton or someone like that. Not to dismiss those organisations, but that's why we're in the health service. Yeah, Giovanna, of course you can. Yeah.
Can I just make another comment? I'm not promoting HFMA materials, but we've actually got a 3-year programme that we've actually bought from HFMA, and some clinicians have been reluctant to do this 5-module, and they get an introduction to finance certificate, but it could probably serve the purpose. And the ones who've actually done it, and I've had quite a few, about 50, who've actually done it, have actually come and thanked me for letting them do it, because they actually now understand finance and they understand the context. They can see the bigger picture. So when we do say no occasionally, they can understand where we're coming from and they understand some of the language. So there are materials out there already, and it seems to be working in our organisation, and it's for finance and non-finance staff.
Yeah, I did one of those introductory certificates 3-4 years ago, and quite an interesting thing about that, I think it was something like £161 and 80 pence or something like that. So the reason I say this...
Is that with or without VAT?
I think that was including VAT. The funny thing was when the HFMA put the payment through, they put 1,680 something. So I had to contact them, and as it happened, that was just after my date for the credit card went through. So then I had to actually make that payment for that month, and so that's how I remember it. And then, as a sorry, the HFMA refunded me 50% of that. So I managed to get that out of it.
Thank you very much. I'm not quite sure what that's about HFMA, but there you go. Right, can we say thank you to Giovanna and Raju for coming up on stage at very short notice in Giovanna's case, willingly in Raju's case, and it's really interesting to hear that there are so many things going on locally, and that our clinical colleagues are so keen to work with us. So can we just say thank you to them for their time? Thank you.